ECHO panel who are joining us now. That includes Dr. Masa Narita, who is the Disease Control Officer for Seattle and King County and a Professor of Medicine in the Division of Pulmonary Critical Care at the UW. Dr. Sylvia LaCourse, who's an ID specialist in the UW system and is both an excellent TB clinician and also researcher. And Liz Crayson, who is the Medical Director of the Seattle and King County TB Control Program. I'm going to briefly introduce TB ECHO for some of the folks on the call that haven't or aren't familiar with it, and then we're going to move on to our speakers. MJ, next slide. So probably all of you know what World TB Day is. It's March 24th, and that day was picked because that's when Koch announced his discovery of the TB bacillus in 1882. That was a big deal. It has a slogan every year. This year's slogan is, "Yes, we can end TB." And the goals for this year and most years are to raise awareness, share successes, and stimulate further work toward TB elimination. I'm hopeful that our two talks will achieve those goals today, but I also think that our weekly ECHO sessions achieve those goals as well. And so I wanted to just put a quick plug in for our ECHO before we introduce the speakers. Next slide, please. So what is ECHO? ECHO stands for Extension for Community Healthcare Outcomes. It was developed at the University of New Mexico for viral hepatitis, but since then has expanded to many other diseases and also different institutions, including the University of Washington. There's ECHOs for many different disease processes, including TB, and participants present cases virtually. They receive guidance and support from the entire community, and then also a specialist panel, and there's also didactic sessions. Next slide, please. Specific to Washington State, TB ECHO, if you aren't participating and want to, we very much welcome you. It's Mondays at 12:30 Pacific Standard Time. It's via Zoom. Anyone can participate. It's free. We want input from public health departments, but we also really welcome primary care providers, ID and pulmonary specialists, really anybody that has an interest in TB. It's case reviews presented by ECHO participants and then didactics supporting clinicians and TB programs that manage TB disease and LTBI. You get mentoring from TB specialists, and then there's also continuing medical education for the didactic sessions. Next slide, please. So in 2022, here's some data. I want to point out that David Horn was the medical director up until November of last year. He's moved on to some really interesting things at the university, and I'm trying to fill his big shoes. So he should take the credit for most of these numbers. But we get about 57 participants per session. 30 of those participants usually come from local health jurisdictions. 21 on average have been nurses, and 13 on average have been physicians, either MD or DO. Next slide, please. This is a map in Washington State about where participants came from in 2022. You can see that we're getting most counties. If anybody's out there from some of the gray counties, please join so we can expand our map. Next slide. We also get participation nationally. You can see that we're joined from a number of different states. Same thing. If you're from a state that's not on here, please join. And then next slide. And we also had participants in 2022 from Mexico, Canada, and Myanmar. So it's really an interesting session to join people from all over with a lot of different experience and perspective. And I'm really enjoying it thus far. Next slide. If you want, so I see somebody in the chat said, how can you sign up for the meetings? And this is how. So please go to this website, and there's a link there to register. And we welcome everybody. So that's just a brief plug for TB ECHO. But as I said, most of this session is going to be focused on our speakers. Before we hear from Renee, we're going to have a review of current national and Washington State TB epidemiologic trends presented by Kelsey Hewson, who's an epidemiologist for the TB control program in the Washington State Department of Health. Kelsey has been part of that program since January of 2021 after receiving an MPH from the University of Washington. And she's a returning presenter for our TB ECHO World TB Day. It's her third time speaking. We really appreciate her doing so. Thank you both for joining us today. Kelsey, please get started.
Sounds great, thank you. Hello everyone, my name is Kelsey Hewson and I'm an epidemiologist with the tuberculosis program at the Washington State Department of Health. And today I'm going to be providing a brief overview of tuberculosis epidemiology in Washington State. This is going to help orient us to the topic before Renee speaks. And to ensure that we stay on schedule, please hold any questions until the end of all presentations, or we could discuss them offline. Next slide, please. Just a quick disclosure, neither I nor my spouse or partner have or had financial or other relationships with any commercial interest organizations in the last 12 months. Next slide, please. Our objectives for this presentation are to describe TB trends in Washington State and use TB epidemiology data to identify populations at risk for LTBI and TB disease and to improve timely diagnosis. Next slide. Some key points for this presentation. On average, 5 cases of TB disease are diagnosed in Washington each week. TB disease occurs in most areas of Washington and is more concentrated in urban areas. And TB disproportionately affects vulnerable populations in Washington. And the past few years have brought many new challenges, and it's important to consider both the COVID-19 pandemic and a Department of Corrections TB outbreak for context when looking at this data. We'll talk a little bit more about each of those topics on following slides. Next slide, please. This graph displays reported tuberculosis or TB disease cases for the last 30 years in Washington State. The bars indicate the case counts for each year, and the dashed line is a linear trend line for this data. You can see that over the last 30 years, case counts are trending downwards with increased fluctuation in recent years. In 2020, there was a significant decrease in cases with a case count of 163. And that was followed by significant increases in 2021 and 2022 with 199 and 251 cases respectively. It's likely that the COVID-19 pandemic influenced these recent fluctuations, and the drop in 2020 was likely multifactorial. This could have been impacted by increased social distancing, potential delayed or missed TB diagnoses, and/or strained capacity at healthcare facilities. And increases in the past 2 years are again likely to be multifactorial and could have resulted from loosening COVID-19 restrictions, delayed care seeking, among other reasons. It's difficult to pinpoint the effect of COVID-19 on TB case identification, given this multitude of reasons. Another event that impacted our recent case count is a Department of Corrections TB outbreak, which we will discuss on the next slide. And this slide shows case counts as seen on the prior slide. It's just a zoomed in time frame looking at the last 10 years. We've shaded in green cases associated with the Department of Corrections or DOC outbreak. And currently 27 counted cases are associated with this outbreak. The first 2 were counted in 2021 and 25 were counted in 2022. And you can see that the Department of Corrections cases impacted our case count substantially in 2022, but it doesn't account for the full increase in cases that we saw. And there have not been any Department of Corrections cases counted in 2023 to date. However, with tuberculosis outbreaks, it's important to note that there can be a long stretch of time between cases, and this outbreak is still considered ongoing, and persons are still being screened for TB. Next slide, please. This slide shows TB case rates over the last 30 years. The solid blue line represents Washington rates, the dotted purple line represents the US rates, and the dotted gray line represents the target case rate for 2025 and the goal of TB elimination. Over the last 30 years, incidence rates in Washington have progressed downward overall, and more recently, there was a significant decrease in the TB case rate in 2020, followed by increases in 2021 and 2022, and this is similar to the trend seen in the US as a whole. And in 2022, the TB case rate in Washington was 3.2 cases per 100,000 population, and the US case rate was 2.5 cases per 100,000 population. Like we previously discussed, these recent fluctuations in case rate can partially be explained by the impacts of COVID-19 and an outbreak in Washington correctional facilities. Next slide, please. This map illustrates TB case counts over a 5-year period in Washington counties. Counties in dark blue have an average of more than 10 cases of TB reported per year. Counties in teal have an average of 5 to 10 cases, and counties in light blue have less than 5 cases. We've included average case counts for Snohomish, King, and Pierce to differentiate the counties with more than 10 cases. Snohomish had an average of 25 cases, King 106, and Pierce 21 cases over this 5-year time frame. You may notice that there are very few Washington counties shaded in gray, which here represents those counties with no reported TB disease cases over this time period. TB disease occurs in most areas of Washington and is more concentrated in urban areas. This slide shows next slide, please. This slide shows TB case rates by age group and sex at birth. Males are shaded in green and females are shaded in blue. From 2018 to 2022, higher case rates of TB were experienced by males compared to females. And over the same period, when stratified by age group and sex as presented here, males aged 65 and over experienced the highest case rate compared to all other groups at 5.5 cases per 100,000 persons. Next slide, please. There are many risk factors to consider when thinking about TB in Washington. This slide shows the prevalence of 6 common risk factors among Washington TB cases from 2018 to 2022. When we talk about risk factors for tuberculosis, these can be risk factors for being exposed to and infected with TB, or they can be risk factors for progressing from TB infection to TB disease. And please note that individuals may fall under more than one risk category. From 2018 to 2022, Washington residents born somewhere other than the US and its territories accounted for 75.4% of TB cases in Washington. And TB is more prevalent in certain parts of the world other than the US, and therefore risk to exposure to TB is greater for people in those areas. And certain medical conditions can lessen the ability of the immune system to keep TB infection from progressing to TB disease. And diabetes is one example of this. 22.4% of TB cases in this 5-year period had a diagnosis of diabetes at or before their diagnosis of TB. And during the same 5-year time period, 10.4% of TB cases in Washington were a known contact of a person with infectious TB within 2 years prior to their diagnosis. And like the first risk factor mentioned, this relates to a greater risk of exposure to TB. And 5.3% of cases during this time had reported excess or heavy alcohol use in the year prior to diagnosis. And heavy alcohol use can impact the immune system and is therefore another risk factor for progression from TB infection to TB disease. 4.6% of cases during this time period reported experiencing homelessness in the year prior to their diagnosis, and 3.9% of TB cases resided in a correctional facility at the time of their diagnosis. And congregate settings can increase likelihood of exposure to TB. And note that the prevalence represented here is over a 5-year time frame, and the Department of Corrections outbreak spans 2021 and 2022. And these are just a few examples of risk factors for exposure to TB and progression from TB infection to TB disease. Next slide. In most cases, tuberculosis is treatable and curable. However, persons with TB can die if they do not get proper treatment. Among TB cases diagnosed in Washington from 2018 to 2022, approximately 7% of patients died before diagnosis or during treatment, and 60% of those deaths were attributed to TB disease or TB treatment. And early and accurate detection of TB is important in reducing TB deaths in Washington. Next slide. And CDC recently launched their Think, Test, Treat TB campaign to increase testing and treatment for latent TB infection in the US. And more information can be found by following the hyperlink on this slide. Next slide. World TB Day is observed each year on March 24th, and the Stop TB Partnership has selected Yes, We Can End TB as the 2023 theme. This theme reminds us that we have a collective power to end TB. We've made great progress so far, but there's a lot of work to be done in eliminating TB. Next slide. And please feel welcome to contact us at the state TV program. And our contact information is listed here and is also available on our website. And thank you for being here today and joining us for the session. And again, please hold any questions until the end of all presentations. Thank you.